How do surgeons manage hemorrhage during plastic surgery? Imagine a delicate dance where every move counts to keep the blood flowing just right. Managing bleeding during plastic surgery is a critical part of ensuring patient safety and successful results. Surgeons use a combination of careful planning before surgery, precise techniques during the procedure, and vigilant monitoring afterward. Before surgery begins, they assess the patient's health carefully. This includes checking for high blood pressure, blood clotting issues, or medications that thin the blood. If needed, they might pause blood-thinning medicines or adjust doses to reduce bleeding risk. They also work to correct anemia by boosting iron levels or using medications like erythropoietin, which helps increase red blood cell production. Keeping the patient warm before surgery is important too because cold temperatures can impair blood clotting. During the operation, controlling blood pressure is key. Surgeons aim to keep blood pressure stable and not too high, which minimizes bleeding. They use meticulous techniques to carefully dissect tissues and seal blood vessels. Electrocautery devices are common tools that help burn and close off small vessels as they work. Sometimes, they administer medications like tranexamic acid, which helps prevent clots from breaking down too quickly, reducing bleeding. They also apply tissue sealants, special glues or gels, that promote clot formation and help tissues stick together. To further decrease bleeding, surgeons often inject a solution called tumescent fluid, which contains saline, local anesthetic, and epinephrine. The epinephrine causes blood vessels to constrict, reducing blood flow to the area. Maintaining the right operating room temperature and warming the fluids used during surgery also helps keep blood clotting functioning properly. In extensive surgeries, techniques like blood conservation strategies, including collecting and reinfusing the patient's own blood, may be used to limit the need for transfusions. After surgery, the focus shifts to preventing bleeding complications. Drains are often placed to remove excess blood and fluid, which can build up and cause pressure or hematomas. While compression dressings are sometimes used to control swelling, their effect on bleeding is limited. Close monitoring of the patient is essential to catch any signs of bleeding early. If bleeding or a hematoma begins to form, quick surgical intervention might be necessary to remove the accumulated blood and prevent tissue damage. Some surgeons continue medications like tranexamic acid after surgery to help maintain clot stability. Emergency protocols are in place to ensure rapid response if bleeding becomes severe, including readiness for surgical re-exploration if needed. For patients with bleeding disorders or those on blood thinners, collaboration with specialists in blood health is vital to manage risks safely. Overall, managing hemorrhage during plastic surgery is a team effort grounded in evidence-based practices. It involves thorough patient assessment, careful surgical technique, the use of medications and devices to promote clotting, and vigilant postoperative care. These strategies work together to reduce complications, protect patient health, and help achieve the best possible outcomes. Always remember, if you are considering surgery, discuss your individual risks and concerns with a qualified healthcare professional who can tailor the approach to your specific needs.